So chest x-rays, there's a whole nuance of chest x-rays, right? There's we actually run entire courses, whole days dedicated on looking at the chest x-ray, because there's so much anatomy involved with chest x-rays. But for the context of trauma, there's only so many things you're looking for. You're looking for a pneumothorax. Yeah, well done. So yeah, exactly, well done. So you're looking for a pneumothorax, and you're looking for rib fractures, dislocations of the shoulder, fracture of the shoulder, clavicles. Genuinely, I had one case where bilateral, so I think this is, so someone was walking along and they fell down a manhole, and they didn't fall right in because obviously tried to stop themselves, and both shoulders got dislocated. So when they went into x-ray, I think they were a bit inebriated. They were drunk, unfortunately. And so they couldn't really tell you like where the pain was. So when they did the x-rays, because the humeral heads looked symmetrical, no one picked up on the fact that had bilateral dislocated shoulders. Quite unfortunate. So it is quite important to make sure that you are aware that there's more anatomy than just the lungs. But in this particular situation, you are looking for any rib fractures. The way to do that is you obviously look at the posterior ribs first, make sure there's no evidence of any fractures there. But then you've got your anterior ribs that go like so. You just want to make sure there's no obvious fractures there. Anterior ribs can be a little bit more difficult to appreciate. Lateral ribs as well, you want to make sure there's no fractures over there. And I've seen people do this, which I've actually used on the occasion, where you put the x-ray sideways and try and see if there's any cortical abnormalities located within the lateral aspect of the ribs to try and identify where there's a fracture there. But quite rightly, a few people have mentioned and quite rightly said, there is some air located over here. So if you're ever unsure about the density of something, the way to try and identify what the density is of anything really is to think about what you know and compare it to something that you don't know. So for example, within the lungs, you know that there is air. So what else within this x-ray has got air? It's going to be everything outside the body. That's going to have air. So if you've got something of this density or something of this density sitting somewhere that it shouldn't be, it's more likely to be air. Anything of soft tissue density is going to look like this stuff over here. The axillary fold has got, your fat, your skin, etc., etc. Anything of bone density is going to look like this. If you see anything like this density sitting anywhere else, you're probably looking at calcifications in somewhere that there shouldn't be. But in this situation, what we can see is a diaphragm over there, and then below the hemidiaphragm, there is this radiolucent line that is sitting over here. That is subdiaphragmatic air, which would therefore be consistent with pneumoperitoneum or subphrenic gas. That can happen because of a perforated intra-abdominal viscus. So there's a perforation that's happened somewhere, or some air that's been introduced into the body somehow from somewhere else. Now, I do have a case which I will be going through later, where you've actually got something called a continuous diaphragm sign, where you've got air sitting.
Imran, sorry to interrupt you, but someone is raising their hand, and I think they would like to talk. Is that okay?
Yeah.
So I'm gonna allow the person to talk now.
Sure.
If they can, have to unmute yourself to talk. Or maybe it was just by mistake by raising the hand.
Okay, sure, no problems. Should we continue?
Yeah, I think so.
Okay, so there's a air within the underneath the hemidiaphragm, which would be suggestive of a perforated intra-abdominal viscus. So this patient will most likely need to go get a CT as quickly as possible. Right.